I am Dr. Rebecca Sloan, an endocrinologist specializing in male aging, vascular mechanics, and hormonal optimization. I am genuinely deeply concerned by a specific, highly destructive pattern I observe in my clinical practice every single week. Men in their early to late 60s sit in my consultation room, incredibly frustrated and completely bewildered. These are not men who neglect their bodies. They are highly disciplined. They monitor their cholesterol, they adhere to strict diets, and they exercise regularly. By all conventional metrics, they are doing everything perfectly to protect their longevity. Yet, they are sitting across from me because their spontaneous morning erections have completely vanished, and their physical response in the bedroom has become entirely unpredictable. They almost universally blame their age or a sudden drop in their testosterone levels. However, after reviewing thousands of patient histories, I have to tell you that the loss of your morning vitality is often not a hormone problem at all. It is being directly caused by a universally recommended, seemingly healthy morning habit that you perform at your bathroom sink every single day, a habit that is secretly and systematically suffocating your vascular system. The sudden loss of spontaneous morning erections is one of the most silently devastating experiences a man can go through. And if you are currently dealing with this highly isolating problem, you need to understand exactly what is happening. I see hundreds of men every year who arrive at my clinic feeling broken, convinced their bodies have simply expired, entirely unaware of the biological self-sabotage occurring in their own bathrooms. Standard medical appointments simply do not provide physicians with the time to explain the complex, localized biochemistry of your vascular tissue. I am going to give you that explanation right now. And by the end of this video, you will understand the exact mechanical failure occurring inside your blood vessels and precisely how to reverse it. To understand how a simple morning routine can paralyze your bedroom performance, you first must understand the microscopic architecture of an erection. It is not a mechanical lever. It is a profound, high-pressure hemodynamic event governed by a single biological molecule. Inside your tissue, there are two cylindrical chambers called the corpora cavernosa, which are essentially dense networks of spongy smooth muscle and microscopic blood vessels. The inner lining of every single one of these blood vessels is a delicate one-cell thick layer called the endothelium. When your brain signals arousal, these endothelial cells must instantly produce and release a gas called nitric oxide. Nitric oxide is the ultimate biological vasodilator. It floods the surrounding smooth muscle, forcing it to completely relax. This rapid relaxation allows the arteries to dilate massively, rushing a high-pressure volume of blood into the spongy chambers, effectively trapping it to create rigid pressurization. Without that initial, powerful surge of nitric oxide, the smooth muscle remains tightly contracted, the arteries stay narrow, and an erection is biologically impossible. The clinical crisis that occurs as men age is a matter of enzymatic degradation. In your 20s, the endothelial cells inside your blood vessels are highly efficient at producing nitric oxide internally. However, years of cellular aging, unavoidable oxidative stress, and microscopic vascular inflammation slowly damage these delicate cells. Data published in major cardiovascular journals indicates that by the time a man reaches the age of 60, his internal capacity to produce nitric oxide drops by as much as 75%. This dramatic decline is the exact reason spontaneous morning erections begin to fade. However, human biology possesses a brilliant secondary backup system to generate this master molecule. It operates entirely outside of your damaged blood vessels, and it relies exclusively on a highly specific colony of commensal bacteria living in the deep crypts at the back of your tongue. When you consume dietary nitrates, which are found abundantly in leafy greens like spinach and root vegetables like beetroot, your salivary glands concentrate these compounds in your mouth. The specialized bacteria on your tongue immediately feed on these nitrates and convert them into nitrites. When you swallow, these nitrites mix with your stomach acid and specific blood enzymes, transforming directly into circulating nitric oxide. For a man over the age of 60, whose internal vascular production is failing, this oral bacterial pathway becomes his absolute primary lifeline. It is the main biological engine keeping his blood vessels dilated and his erectile tissue functional. The devastating healthy morning habit that is destroying this entire system is the daily use of commercial antibacterial mouthwash. We have been conditioned by decades of aggressive marketing to believe that a completely sterile, chemically blasted mouth is a healthy mouth. Millions of men wake up, brush their teeth, and aggressively swish alcohol-based or chlorhexidine-based mouthwash, believing they are protecting their hygiene. What they are actually doing is committing localized biological warfare. Antibacterial mouthwash is entirely indiscriminate. It completely eradicates the essential nitrate-reducing commensal bacteria on the back of the tongue. When you destroy this oral microbiome, you completely sever your body's backup nitric oxide pathway. You can eat the healthiest diet in the world, but without those specific bacteria present, those dietary nitrates will pass through your digestive tract completely unutilized. By sterilizing your mouth every morning, you are artificially inducing a severe systemic nitric oxide deficiency, completely starving your blood vessels of their primary vasodilator. This specific destruction of the oral microbiome also explains the tragic failure of conventional prescription medications. Synthetic pills do not spontaneously create erections, and they do not generate nitric oxide. Their entire pharmacological mechanism relies on preventing the breakdown of secondary chemicals that are only produced after nitric oxide has successfully relaxed the smooth muscle. If you are systematically destroying your body's ability to produce nitric oxide by using antibacterial mouthwash, the synthetic pill has absolutely nothing to amplify. This is why patients continually increase their dosage, enduring agonizing side effects like intense facial flushing and severe headaches, while experiencing absolutely zero functional improvement. You cannot chemically force a biological system that is missing its foundational raw materials. The immediate first step in rehabilitating your vascular system is to permanently throw the antibacterial mouthwash into the trash. The oral microbiome is remarkably resilient, but it takes time to repopulate. You must allow the specific facultative anaerobic bacteria to recolonize the crypts of your tongue so the nitrate conversion pathway can resume. Once you stop the chemical destruction, you must actively feed the recolonizing bacteria. This involves integrating concentrated dietary nitrates into your morning routine, such as a cold-pressed beet juice shot or a heavy serving of arugula. The critical mechanical step here is that you must hold the liquid or chew the greens slowly in your mouth for several seconds before swallowing, allowing your saliva and the returning bacteria adequate time to initiate the chemical conversion into nitrites. Before we move on to the specific biochemical intervention required to repair the internal damage, I want to take a brief moment to ask for your support. If you are finding this level of precise, evidence-based medical biochemistry valuable, please take a second to subscribe to the channel and like this video. This specific type of clinical education, stripped of marketing and sensationalism, fundamentally belongs in the doctor's office, not just on the internet. By engaging with this content, you help the algorithm push this critical vascular information to other men who are currently sitting in silence, believing that their physical decline is inevitable. For years, my clinical philosophy was strictly bound to lifestyle modifications. I refused to recommend any form of supplementation to my patients, preferring to rely entirely on correcting dietary habits, stopping destructive routines like the use of mouthwash, and optimizing sleep. I viewed the entire supplement industry with profound skepticism. However, as a clinician, you must evaluate the reality of patient outcomes. I consistently observed that while stopping the mouthwash and increasing dietary nitrates worked well for younger men, there was a specific subgroup of patients who hit a frustrating plateau. For men over the age of 60 who had been suppressing their nitric oxide production for decades, their vascular endothelium was simply too scarred and chronically inflamed to respond to dietary shifts alone. Their localized tissue required a much deeper level of biochemical scaffolding to physically reduce the stiffness of the blood vessels and restore the hormonal signaling that initiates the entire process. This clinical reality forced me to investigate natural pharmacological compounds with documented mechanisms of action, and I eventually found a highly specific combination that I now integrate into my advanced patient protocols. The formulation relies on two primary biological interventions. The first is alpha-lipoic acid. This is a potent, fat and water-soluble antioxidant that specifically targets the peripheral vascular system. It aggressively neutralizes the reactive oxygen species that cause microscopic scarring, effectively reducing the localized inflammation that makes your pelvic blood vessels stiff and unresponsive in the first place. The second critical component is maca andina. In clinical literature, this specific adaptogen regulates the central hormonal axis without interfering directly with your systemic testosterone levels. It acts directly on the signal sent by the brain to the reproductive organs, amplifying the initial arousal trigger that tells the endothelium to start producing nitric oxide. In men between the ages of 62 and 68 who had previously hit a plateau, I have observed a measurable, consistent shift in morning predictability within 4 to 5 weeks of introducing this specific biochemical support. It is absolutely vital to understand that this is not a synthetic drug. It is targeted nutritional support with a heavily documented biological mechanism. Because purity is my primary concern, I only recommend formulations that have undergone rigorous independent laboratory testing to verify the exact concentration of active ingredients and the complete absence of heavy metals or synthetic adulterants. I have placed the link to the specific formulation I use in my clinical practice in the pinned comment below this video. You can access it there, review the clinical literature, and evaluate the precise composition of the ingredients for yourself at your own pace. Understanding this mechanism is about far more than just restoring your morning vitality. It is about recognizing the profound interconnected nature of your vascular health. The microscopic arteries in your pelvic tissue are significantly smaller than the coronary arteries feeding your heart. Because of their tiny diameter, they are mathematically guaranteed to be the very first vessels to become blocked or unresponsive when your systemic nitric oxide levels drop. We view erectile unpredictability as the ultimate leading indicator of systemic cardiovascular disease. If the endothelium in the pelvis is failing to dilate today because you have destroyed your oral microbiome, the critical blood vessels in your heart and your brain are already under severe, silent stress. Furthermore, if this localized vascular hypoxia is left unaddressed, the tissue itself begins to permanently alter. Healthy erectile tissue requires regular, oxygen-rich blood flow to survive. When nitric oxide deficiency prevents your spontaneous nocturnal erections, the spongy, smooth muscle inside your anatomy literally begins to starve. Over time, your body replaces this dying, elastic muscle with tough, inflexible collagen, a process known clinically as penile fibrosis. Once the tissue becomes fibrotic, it permanently loses its ability to expand, permanently altering both function and physical size. I have observed that men who correct this oral pathway and rehabilitate their endothelium do not merely recover their intimacy. They frequently report a dramatic normalization of their systemic blood pressure and a profound return of cognitive clarity. We have covered a significant amount of complex physiological information today. We have established that the root cause of your declining morning erections is often not your age, but the systematic destruction of your oral microbiome through the daily use of antibacterial mouthwash. We discussed the critical nitrate-nitrite-nitric oxide pathway, why conventional medications fail in a depleted system, and the precise biochemical support required to reduce vascular inflammation and amplify central hormonal signaling. Write your age in the comments below and tell me, have you been aggressively using commercial mouthwash every morning, genuinely believing it was protecting your overall health? The human body possesses a remarkable degree of biological plasticity, which is the inherent capacity of your vascular endothelium to heal, adapt, and restore elasticity when provided with the correct stimuli. However, regarding the smooth muscle of the vascular system, that window of responsiveness steadily narrows as calcification and fibrotic tissue begin to accumulate. Intervening while the endothelial cells are still capable of responding to nitric oxide is the absolute key to reversing the mechanical decline. The nutritional support protocol I discussed earlier is specifically designed to amplify these exact physiological adaptations, providing the precise biochemical environment your vessels need to heal when stopping harmful habits is no longer sufficient. The link is located in the pinned comment below for you to examine the science and the composition directly. Reversing years of vascular damage is a matter of correct cellular signaling and immediate intervention, not just hoping time will heal what daily habits have systematically destroyed.